When people hear resilience, they often picture seawalls, solar panels, and engineering. But for a lot of communities, resilience is also about whether clinics stay open, medicines arrive, and power stays on during heat, floods, and storms. Today's story is about leadership capacity. Quiet on the surface, huge in what it enables. The University of Melbourne, working with the Pacific Climate Change Centre, has secured Australian Awards Fellowship funding to strengthen climate, energy, and health resilience across small island developing states. As SREP reports it, the grant from the Australian Awards Fellowship Initiative will fund 15 fellows to attend a 6-week program hosted by Melbourne Climate Futures, the university's climate change research initiative. This matters because for many island nations, climate shocks do not arrive one at a time. A cyclone can knock out power, cut off roads, disrupt water supply, and strain health services all at once. A cyclone is not only a weather event, it can become a healthcare event fast. A power outage can shut down oxygen machines and refrigeration. A washed out road can stop nurses getting to work. Flooding can contaminate water and trigger outbreaks. Supply chains can break and delay medicines for weeks. That is why the resilience conservation has to include health systems and energy systems together, not as separate topics. Here is the key link. Energy enables healthcare. If energy fails, healthcare fails quickly. Vaccine refrigeration, sterilization, labs, communication, cooling in extreme heat, and even basic lighting can become unreliable. So adaptation is not only about protecting homes from storms, it is also about keeping essential services operating through the shock. If you want a simple mental model, think in a triangle. Climate, energy, health. Each side affects the other too. It's easy to underestimate training and networks because they're not visible like a seawall. But resilience depends on people who can plan, coordinate across departments, access finance, turn evidence into policy, and communicate clearly to communities. That is what capacity building does. It increases the odds that practical solutions get implemented, funded, and maintained. This is also a cross-region collaboration story. The Pacific Climate Change Portal notes, our 2025-26 program will extend this partnership to include the Caribbean Community Climate Change Centre, with 5 policymakers from small island states in the Caribbean participating. That matters because shared problems become shared playbooks. When one place solves a recurring challenge, the solution can travel faster through trusted relationships. And there is one detail I love because it makes the program feel tangible, not abstract. A lot of climate change coverage accidentally centres outsiders. This one centres leaders from the regions living with the risk now, building expertise and bringing it home. That is social sustainability, agency, governance, and capability that stays in community after the news cycle moves on. 3 practical takeaways you can keep for how you think about climate stories. First, ask what happens to healthcare during disasters, in specific terms. Water, power, transport, staffing, communications. Second, treat energy resilience as health resilience. Distributed power, backups, efficiency, cooling, and maintenance are not just technical detail, they're health measures. Third, treat leadership networks as climate infrastructure. They speed up learning, coordination, and follow-through. Sometimes a phone call to someone who has already solved the problem is as important as equipment. The core point is simple. In many places, climate resilience is health resilience, and health resilience is energy resilience. Thanks for watching.